Bismillahirrahmanirrahim. The topic of today's discussion is GIT, chapter number 3. Point number 34. The bile salts are absorbed from the ileum. Bile salts are absorbed from the ileum. Bile salts absorbed from the ileum. Remember, sodium chloride in small intestine. Sodium chloride is absorbed from the small intestine and colon. Potassium is absorbed from the small intestine and actively secreted in the colon. Potassium is secreted in the colon and absorbed in the small intestine. Sodium is absorbed in the small intestine and colon. Water 80% absorbed in the small intestine, 10% absorbed in the colon, and 10% excreted in the feces. Fat soluble vitamins A, D, E, and K absorbed with lipids in the small intestine. Fat soluble vitamins A, D, E, and K are absorbed with lipids in small intestine. Folate absorbed in small intestine. Calcium absorbed in small intestine. Iron absorbed as ferrous ion in duodenum. Iron absorbed in duodenum. Vitamin B12 absorbed in terminal ileum requires intrinsic factor that is present in the stomach. Vitamin B12 requires intrinsic factors which is present in the stomach and it is absorbed in the terminal ileum. And iron is absorbed in the ferrous form in the duodenum. Bile salts are absorbed in the ileum. Now let's discuss some past MCQs. The vitamin B12 is absorbed in ileum. Vitamin B12 is absorbed in ileum or terminal ileum. A female undergone gastrectomy was given the parental vitamin B12. The inability to absorb vitamin B12 occurs due to the loss of which cells during gastrectomy? Parietal cells. Loss of parietal cells will lead to the vitamin B12 deficiency because the vitamin B12 is not absorbed because the intrinsic factor is produced by the parietal cells in stomach. Iron absorption. Iron absorbed from which part? Proximal duodenum. Iron absorbed from the proximal duodenum in the ferrous form. Most likely regarding iron absorption is absorbed in the ferrous form. It is absorbed in the ferrous form. It is absorbed in the proximal duodenum. Iron absorption best increase with citrus fruits. Iron absorption is best increase with citrus fruits. Regarding iron transport in the form of transferrin. Iron transport in the form of transferrin. Iron absorbed in the form of ferrous form. Iron absorption is increased with citrus fruits. Iron is absorbed from the proximal duodenum. With low transferrin saturation, how will iron be absorbed? Free iron absorbed readily than the bound form. If there is low transferrin saturation, iron will be absorbed in free iron. Free iron absorbed readily than the bound form. Free iron absorbed readily. Most likely about iron absorption, heme is readily absorbed. Dietary is mostly in the ferric form, which is least absorbable. Heme contains ferrous form and readily absorbed. Most likely absorption occurred through heme. Heme has ferrous form, which is readily absorbed, and the dietary iron is in ferric form, so it is least absorbable. About sodium. Sodium is actively absorbed from the colon. Maximum active transport of sodium occur in colon. Maximum active transport of sodium occur in colon. Sodium is actively absorbed in the colon. Remember, sodium is actively absorbed from both colon and jejunum. Sodium is actively absorbed. Sodium is actively absorbed from both colon and jejunum. But active transport of sodium is more in colon than jejunum. Active transport is more common in colon. Sodium is actively absorbed from both colon and jejunum. Jejunum. Water mostly absorbed from jejunum. Dietary fats is absorbed chiefly in the jejunum. Dietary fats are absorbed chiefly in the jejunum. Dietary fats are absorbed chiefly in the jejunum. Water is mostly absorbed in the jejunum. Know the difference. Maximum absorption of fluid occur in jejunum. Maximum water loss of fluid occur through colon. Maximum water loss occur through colon. Maximum absorption occur in jejunum. Maximum water loss and electrolytes. Water loss and electrolytes occur through colon. Patient underwent abdominal surgery after which he repeatedly required fluid resuscitation due to water and electrolyte loss. Which part of the gut has been removed leading to this condition? Ileum. If the ileum is removed, then the patient has repeatedly required fluid resuscitation due to the water and electrolyte loss. Which part of his gut has been removed leading to this condition is ileum. Jejunum, when removed, will be compensated by the terminal ileum. However, the ileum resection lead to the fluid loss as colon not able to absorb sufficiently. If jejunum is removed, terminal ileum will compensate for it. But if the ileum is removed, it will not compensate it by the colon because colon cannot absorb sufficiently. So if the patient underwent abdominal surgery and he develops need for fluid resuscitation, repeated fluid resuscitation due to water and electrolyte loss, then the which part of the gut is removed? It is the ileum. A patient with the fluid loss now shows metabolic acidosis with hypokalemia. Patient has fluid loss, metabolic acidosis, hypokalemia. Most fluid loss will be through colon. Most fluid loss will be through colon. Others, drug absorbed through aqueous diffusion, digoxin. Digoxin is absorbed through aqueous diffusion. Digoxin is absorbed through aqueous diffusion. Which of the following substance must be further digested before it can absorbed by specific carriers in the small intestine? Which of the following substances must be further digested before it can be absorbed by specific carriers in the intestinal walls? Is sucrose. It must be further digested before absorption. Fat derived from nutrition is absorbed from the intestine by preparation into mixed micelles. Fat derived from nutrition is absorbed from intestine by preparation into mixed micelles. Fats forms mixed micelles. Which of the following substance must be further digested before it can absorb by the specific carriers in the intestinal cell? Is sucrose. It must be further digested before it get absorbed by specific carriers in the intestinal cells. Is sucrose. Fat derived from nutrition is absorbed from the intestine by preparation into mixed micelles. Fat forms mixed micelles to be get absorbed from the intestine. Resection of the ileum and some part of the jejunum cause 10 to 20 bowel movements per day. If the resection of ileum and some part of the jejunum will occur, then the bowel movements will be 10 to 20 bowel movements per day. Cause is osmotic plus secretory diarrhea. Cause is osmotic plus secretory diarrhea because the water is not absorbed, the electrolytes are not getting absorbed, so patient has developed osmotic diarrhea and secretory diarrhea. Explanation: decreased ileal absorption of bile salts result in the fat malabsorption. Decreased ileal absorption of bile salts result in fat malabsorption and steatorrhea. The presentation of increased amount of bile salts and fatty acids to the colon decrease water absorption and stimulate the active chloride and water secretion, producing a cholera-like high volume secretory diarrhea. If the ileal is resected or jejunum is resected, ileal resorption of bile salts will not occur. Will result in the fat malabsorption and steatorrhea. More fat will reach more fatty acids and bile salts will reach colon, and it will hinder the water absorption and stimulate the active chloride and water secretion, producing a cholera-like high volume secretory diarrhea. The loss of the ileocecal valve and ileum segment accelerates intestinal transit time, which does not allow for the complete digestion and absorption of food. Because of the loss of ileocecal valve and ileal segment, intestinal transit time is increased, and which does not allow for complete digestion and absorption of food. Water and electrolytes remain associated with undigested food particles and may overwhelm the absorptive capacity of the colon, resulting in osmotic diarrhea. There will be secretory diarrhea due to fats, and there will be osmotic diarrhea because the water is not absorbed or electrolytes is not absorbed. Secretory diarrhea due to the bile salts and the fats, fatty acid reaching the colon, and there will be the active chloride and water secretion. And osmotic diarrhea is due to the water and electrolytes remain associated with the undigested food particles, so the absorptive capacity of the colon overwhelm and resulting in the osmotic diarrhea.